Hi, I'm Michael Betel, President and founder of the Fatty Liver Alliance. We are here in Vancouver, British Columbia. I have Dr. Alnoor Ramji here, hepatologist. We had an incredible event tonight. And what did you think of, well, first of all, the interaction was amazing, right?
Yeah, so it really was a fantastic event. There was a good number of persons out here, and I think the engagement was excellent. That's what really makes an event, I think. There was a lot of interest, and the context of interest about person's health, about what to do, how to get evaluated. I think we had the whole realm of fatty liver disease and the context of even advocacy, which I think is key in what we're doing.
And we did about, I hadn't seen the final numbers yet, but over 40
really?
fiber scans tonight, which is a lot.
Good number.
And I know a lot of people had questions about that also. What I was surprised about is that a lot of people knew that they had fatty liver before, but their doctors didn't really do anything. It was kind of disturbing a little bit.
I do agree. I mean, I think this is a constant theme, is that patients are worried. Sometimes physicians don't always explain it enough, perhaps, or don't evaluate it to the patient's satisfaction. Mm-hmm. And I think it's that context of dialogue to try and either ensure that the patient understands what's going on with that or refer as needed so that they can get that further second step of evaluation. And I'm happy to hear that persons are worried about it, because they should be worried about it, because we can do something about it, and they are trying to advocate for that evaluation and the next steps.
So what would you recommend a patient does? They have risk factors. Maybe they know that they're type 2 diabetic, obviously. They know they've been struggling with obesity probably for most of their lives. They maybe have some other. What do they say to the primary care doctor? They have their appointment, their annual. What do they say?
I think, these days time is challenging with a family doctor. And I think it's making a point of saying, this is my one problem. I have diabetes or obesity or high blood pressure, cholesterol, and say, I really want to address the context of maybe fatty liver disease. Can you evaluate me for that as part of this appointment? And I've heard of the FIB4, or I'd like to do this, and talk about it in that fashion, as opposed to, I'm here for my vaccine and I'd like to do this. You know what I mean? I think it's a special event, and that's what, and this way it'll help the family doctor to say, let me focus on this for you. Because sometimes it's not a lot of time with the family physician.
Okay, that's great. Well, thank you so much. The presentation was fantastic, honestly, and the community was clearly interested in learning more about their liver and their health.
We've got a good Vancouver fatty liver disease community. I think it's good, it's important, and it's good to have the patients out there, because that's, or the public out there, because that's who this is about. So, and thank you. This is a super job.
This is the largest one we've done anywhere, and just so you know, we're going to be making our way across Canada. So thank you for joining us today.
I'll drive. Am I driving across? Thank you.
Thanks.